The World Professional Association for Transgender Health, WPATH, will soon release its Standards of Care version 8, which is expected to lower its age recommendations for children to receive gender surgeries. Specifically, it would lower the age of breast removal to 15 years old and bottom surgery, including womb and testicle removal, to 17 years of age. Now, this is a year earlier than the previous guidance. Now, WPATH is expected to release these updated guidance next week, and children's hospitals nationwide will be under the microscope as they decide whether or not they march in lockstep with this organization's guidance, as too many have in the past. Now, is this being driven by science, or is it being driven by politics? Joining me now to discuss this, Dr. Jennifer Bauwens, Director of the Center for Family Studies here at the Family Research Council. Jennifer has extensive clinical and research experience working with survivors of trauma and abuse and has also taught on psychological trauma and research methods in several graduate programs across the nation. Dr. Bauwens, welcome back to Washington Watch.
Thanks for having me, Tony.
All right, so tell us more about this organization, the World Professional Association for Transgender Health. What type of organization it is? Is it? How much influence do they have with medical providers?
Unfortunately, they have a lot of influence with medical providers. So basically, they are an organization, an activist organization that at least their stated goal is that they promote evidence-based care for transgender people. It's really an activist organization under the guise of pseudoscience. And I never thought I'd use my research teaching skills to extend to this realm, because I always believed in science, loved science. But when I look at the work that's produced by this organization, it is anything but science. It's very, very poor quality. And there are a few things that I think are important for our audience to know. And one is, just because somebody says evidence-based practice does not mean it's good. We're going to hear that a lot, especially with this particular administration, because they're promoting such radical ideas that have no basis in science.
I don't track this extremely close. I mean, I watch it because obviously it's a growing issue here in the United States. But if I'm not mistaken, we're seeing other countries that are actually saying, whoa, wait a minute, we got to push the pause button, moving too fast. A lot of problems associated with these surgical procedures being conducted on minors. It appears that America is kind of an outlier here. We're going the opposite direction.
Yeah. You see other countries that they are actually looking at the science and they see that it's such poor quality that, and they're getting backlash, right? So it's not only the science, because, you can kind of wave your hand and pretend that it doesn't exist. You can sort of talk over people that maybe don't know the nuances of it and try to make it sound good. But the reality is these, particularly youth, are experiencing very painful repercussions from these procedures. So it's a combination of the science and these unfortunate experiences that we're observing with these young people. And they're coming out and saying, this was harmful. I was not given full informed consent. I didn't really know what I was signing up for when I was sold this bill of goods. So yes, you see lots of European nations backing away from these practices because they're going to get sued.
Right. So Dr. Bauwens, we see them moving this lower in age, and I can only expect that we'll see them trying to push it even lower. But when you look at the cognitive ability of young people, the emotional development, we actually should probably be pushing it out further when you consider when someone is actually fully developed mentally.
Yeah, yes, absolutely. And common sense tells us this. All we have to do is look at any teenager and some of the risky behaviors that they engage in. And that's primarily because their prefrontal cortex is not developed. So, and we think about our own lives. What were some of the stupid things that we did growing up that we said, oh gosh, I wish, had I known now, I would have never done that, XYZ. And certainly these young people are offered life-changing quote unquote interventions just to go back to my point about evidence-based practice, evidence-based just means whatever's available. So Tony, that means I can develop some intervention and then, maybe have a few web surveys and invite a few people to comment on that. And as we come to a consensus and say, this is the best practice for, I don't know, helping someone get off coffee or something, don't send that my way. But then we say it's evidence-based. And that's what these folks are doing. And it's to the detriment of young people.
So Jennifer, up against a break, but the science doesn't back the lowering of this age.
Absolutely not. And again, common sense tells us that too. Okay. So we'd really have to have great evidence to say otherwise to go against our what we know in everyday life.
Jennifer, always great to talk with you. Thanks so much for joining us today.
Thanks for having me, Tony.